ferritin is essentially the storage tank. And this is the most important fertility marker of the entire group. When we're talking low or high ferritin, we also want to remember that ferritin is an acute phase reactant. So what this means is when we are in an inflamed state, the liver is going to dump ferritin into the bloodstream, kind of as an anti-inflammatory. That's what it's trying to use it as. So when we're in an inflamed state, we'll see these ferritin levels start to really increase. So that can happen from infections, inflammation, a laundry list of different things. And I typically see this in men more often than women. And that is because when women are of childbearing age and having a monthly menstrual cycle, they're bleeding every month. So even if they have higher levels, whether they have hemochromatosis, which is iron overload in the body, or these inflammatory markers, we bleed it out every month, essentially. Where with men, we're not bleeding it out every month as a male. So that ferritin builds up and builds up and builds up. So that can either be hemochromatosis, or it can be because it's an acute phase reactant, which is typically the most common. It's an inflammatory marker. There's inflammation going on in the body, and the body is dumping ferritin as a red flag that it needs support.